So this is now looking at some results from a study that we did in the health professionals follow-up study, where we looked at the relationship between sugar-sweetened beverages as well as diet soda and risk of diabetes. And so the top of the chart is showing when in the fully adjusted model, there's about a 24% increased risk for diabetes for sugar-sweetened beverages, comparing extreme categories of intake, so 1 or more per day versus none. So now when we look at the diet soda, I think we can see how if you don't carefully adjust your analyses, where things might go wrong. In the age-adjusted model, we can see a 90% increased risk of diabetes, but and then in the multivariate adjusted model, similar. But then when we start thinking about issues of reverse causation and start adjusting for certain covariates that we think might address that, we start seeing the estimate attenuate. And so in this study, Larry DeKoning paid quite a lot of attention to that, adjusted for family history of diabetes, triglycerides, blood pressure, high blood pressure, high triglycerides, previous weight change and dieting behavior to really get at this issue, and then looking also adjusted for diet quality, total energy intake, and finally BMI, which is adjusting for BMI was really what was what brought the association down. And so there's this issue with in the sugar-sweetened beverage world where it doesn't really make sense to address for total energy or BMI, since that's in the intermediate pathway. Well, when it comes to diet soda, that's not necessarily the case. So in the case of analyses looking at diet soda with diabetes and other cardiovascular outcomes, it makes sense to adjust for BMI to try to get at this reverse causation issue. And we can see that the association was no longer statistically significant when it was adjusted for BMI. And so fewer studies have looked at the relationship between diet soda and cardiovascular disease. And this was a meta-analysis published a couple of years ago that looked at, so it was looking at CVD, so it looked at stroke as well as MI. And the studies are so the analysis is really largely driven by individual studies that were done in the Harvard cohorts. And we can see for stroke, there's a positive association between intake of the diet drinks and stroke, but if we look carefully at the individual studies, we can see that that's really driven by the study done in women in the Nurses' Health study, and there's no association in the health professionals that was done in the men. Looking at MI, we can see that there is similarly no association in the men in the health professionals follow-up study, but then we see a non-significant slight positive association in the women, again, not significant. When we look at vascular events, there's a study that was done in the Northern Manhattan study, which was an older cohort, predominantly Hispanic, that had quite low intake levels, actually. And that study found a positive association. So overall, looking at the overall meta-analysis is suggesting a positive association between diet beverages and cardiovascular disease. But again, it's really important to look at the individual studies and to try to understand what's happening. And so this is now a study that's unpublished, where we looked at sugar-sweetened beverages and total and cause-specific mortality, but we also looked at diet beverages and total and cause-specific mortality. And I'm not actually showing the data here for the sugar-sweetened beverage results, since I'm focusing on the low-calorie sweeteners here. But so we can see that this is looking at the categories of intake across the Nurses' Health study, the health professionals follow-up study, and then the pooled data in the green bar. And if we look at total mortality, we can see that it's pretty null until we get to 2 or more servings per day. And if you look in the blue bar, that's really driven by the Nurses' Health study in women. We're seeing a positive association at 2 or more servings per day in women, no association in men. Now, when we go over and look at cardiovascular mortality, similar story. It's not until we really get to the 2 or more servings per day until we see a positive association in women, and we are also seeing a positive association in men, but to a lesser degree. We see a non-significant positive association in men, but we see the pooled estimate. We see a significant pooled estimate there. And then when we look at cancer mortality, we see that there is absolutely no association. But looking at this data and noting that it's really in the 2 or more servings per day that we're seeing this potential association, we thought it would be of interest to see what's happening at higher categories if we look at higher categories of intake. So here, now we decided to break down the categories further. So we have now the highest category in this analysis is 4 or more per day. And if we look at total mortality on the top figure, we can see it's really in this very high intake category that seems to be driving that positive association. And we're seeing this now in women. We're still not seeing an association in the men, which is the positive bar. And then below, we see a similar story for cardiovascular disease mortality, where it really seems that the association is in the higher category of intake of 4 or more per day and is really driven by the women. And we see that there's not association in men. And so this suggests that, well, maybe there's something happening at higher category of intake, or maybe it's reverse causation at that high category, or maybe it's that these individuals had been consuming very high levels of sugar-sweetened beverages in the past and then made a switch to artificially or low-calorie sweetened beverages, and they're drinking the high amounts, but we're still seeing this residual adverse effect of sugar-sweetened beverages. It's not clear, but I think if we look at the factors associated with diet beverages in the cohorts, we can see that younger age, more likely to have hypertension. People who drink higher diet beverages also tend to have a higher BMI. There's a greater tendency to be overweight, and then there is a lower glycemic load. So what this is telling us is that there very well might be reverse causation when we're seeing that people who drink higher amounts of our diet beverages tend to have a higher BMI, tend to be a greater tendency to be overweight, and tend to have hypertension. So they might be choosing to consume diet or low-calorie beverages to manage their weight and their health. And so we also looked at the relationship between low-calorie drinks and mortality stratified by diet quality, which was measured by AHEI. We also looked at it stratified by physical activity, by BMI, as well as by age. And so if you look in the last figure there, in the last bar with the pooled analysis, we can see that the positive association with total mortality is really found in those who have a high physical activity level and those who have a high BMI. So what this is suggesting, again, is sort of suggesting, well, maybe it's really the people who are actively trying to manage their weight and health who are having the higher intakes of artificially sweetened beverages. And again, this is making a case for potential reverse causation. So in this analysis, we also did a substitution analysis where we replaced 1 serving per day of sugar-sweetened beverages with other beverages. And I just wanted to draw your attention to, since we're talking about low-calorie beverages, to the low-calorie beverages. And so here what we see is when we replace 1 serving per day of sugar-sweetened beverages with the low-calorie beverages, there's a modest benefit in risk of mortality. We also see a benefit with other beverages. We see benefit with tea, with water, with coffee, and less so for low-fat milk and juice. But point is, there is a modest benefit when diet beverages are replacing sugar-sweetened beverages for looking at risk of total mortality. And so there are some potential, mechanisms that might explain the adverse associations that some studies are reporting in observational data, or that might speak to why we might be seeing an association at higher intake levels of 4 or more per day. And so one potential mechanism is the habituation towards sweets, and there was some discussion about that yesterday, where having these intense sweet, repeated exposure to sweet taste might perpetuate a preference for sweets. There's also this a behavioral component where people who use diet drinks that could lead to overconsumption of foods elsewhere because they rationalize the low calories from their drinks. And Dr. Mattis talked about potential cephalic phase stimulation of insulin, potential gut peptide response, potential metabolic rate disadvantage. So these are all hypothetical or potential mechanisms that haven't really been proven. So they're still somewhat hypothetical. And we know that there's also been some signals about altered gut microbiota, and we're going to be hearing more about that in the following talk, but there's been some suggestion that certain artificial sweeteners might alter gut microbiota in rodents, leading to weight gain and glycemia, and saccharin led to a similar change in humans in a small subset of studies, but again, we'll be hearing more about that in the next talk, and I think this is an area of great interest. And finally, reverse causation in the observational studies, which we've talked about, might explain some of the adverse associations. But I think, again, Dr. Mattis's point about how the different sweeteners might be acting differently in the body is very well taken. And so some of these potential mechanisms might make sense for some sweeteners and not others. And so I think this is a really active area of research. And so picking up again from some of the points that were raised yesterday, and which will likely also be raised in the last session today as well, is implications for policy. So we know that there's been a lot of movement for soda taxes and policies to reduce added sugar and sugar-sweetened beverages in the population. So how might this impact artificial sweet or low-calorie sweeteners with product reformulation? How will this impact that? And so, if we take a look at some of the recent soda taxes that have been implemented, actually a couple of them actually included a tax on diet beverages as well. In Philadelphia, in Cook County, as well as Seattle, and so. That was an interesting choice, I think. And one of the reasons I've heard is the reason why diet beverages were taxed was to lessen the regressive nature of the proposed regressive nature of soda tax, where what I showed with the NHANES data, it's really the higher income groups that are consuming the diet beverages in greater amounts. So including them in the tax would lessen the regressive impact on lower socioeconomic groups who have higher sugar-sweetened beverage intake. So that's one of the reasons I understand why diet beverages were included in some of the taxing strategies, but others Sarah Blake, Barry Popkin, others might have more to say about that. And so I think another area is when we look at what was done in the UK recently, where a tiered tax was implemented a couple months ago related to the amount of sugar in beverages. So what this really ended up doing is